Today, actually, I came to present in ninth conference of hemostasis by Novo Nordisk to present the burden and the challenges that may face the hemophilic patients. Especially, I emphasized on the psychological and emotional stress that are not well covered in the literature. Only the physical and financial burden have a huge area and covered well. But I think that still the psychological and emotional stress is still underestimated. So today I came here to present the burden and the challenge for hemophilic patients they may face on all sides, physical, emotional, and psychological and financial burdens and the challenges.
So emphasize on that event is because we have a large population of hemophilia and bleeding disorders in UAE and Gulf. So we need a platform where we have to talk about the disease, getting the support for the physician and for the patient, and to learn more about the disease from other colleagues from the Gulf. And we can develop interactive guidelines in between us and also interaction between our society, so we can learn more about what the patient needs are and to develop a comprehensive care program which will be help the patients and their family all across the Gulf.
Actually, being a consultant of hematology, it is very important to attend such a meeting in order to update our knowledge and to share experience with our colleague about the management of hemophilic patient. And really we are facing every day there is a more advance in management, and we need to follow all this knowledge. Yeah.
Okay. We are gathering today to speak about bleeding disorders, especially the rare bleeding disorders, which we want everybody to be oriented about. Although they are very rare, but really they are killer. And can affect the quality of life of patients. So, as professionals, we would like to orient first other physicians about the problems. We want to orient the community. We want to orient the government about the presence of these serious conditions among our population. So with the high consanguine marriage in the region, we are expecting to have a higher incidence of these diseases than in the Western countries. And today, in my talk, I elaborated the importance of these rare bleeding disorders, how we can, as a physician, help the community to early diagnose it. We shared our skills, and I focused in one of the rarest, we can say, of the bleeding disorder, which is the factor 13 deficiency, which can be simply by orienting the community, can be easily detected by the parents, by the general doctors, in the emergency room, in the casualty, so they can be referred as early as possible to specialized hematologists in the treatment and management of these conditions. I have one presentation in this symposium, but the speaker or the presenter of any speech or talk, he is not simply giving his experience or his skills. He's sharing during the presence on this symposium through the questions, through meeting with his colleagues, through discussion of the different issues regarding the patient. So actually, I'm gaining experience as the audience, and for preparing for the presentation, actually, I have to read the up-to-date articles. I have to put it in a very comprehensive way. So the speaker is getting more knowledge and more skills as the audience in this kind of conferences. And as I said in my speech, your knowledge doesn't mean anything if you don't share it. The strength of knowledge is sharing it with somebody else.
Attending such a conferences, it's very practically helping, refreshing and updating ourselves with the update knowledge regarding the medicals informations. And I think sharing other experience will enhance the outcome of our services, especially if you share the experience from our neighbors in the GCC countries with their centers, and plus the worldwide their experience, case studies. It will be at the end a matter of improving our services and updating ourselves about what's going on all around the world.